Good evening, everyone. Um, so we're experiencing a bit of a delay today. Our speaker is having an emergency, so we would give him a bit of time to see if he's able to join in. Um, Otherwise, we would have to shift today's webinar, but we'll just give him some time to see if he's able to join in for the lecture. He's experiencing some emergency. Okay. Good evening once again. Sincere apologies for the time delay. Um, our speaker is having an emergency, so he will not be able to keep up with today's lecture. So in place of that, I'll just be giving a brief talk. However, there will be a recorded version of the lecture. He will give a recorded version of the lecture once he's healthy enough to do so, and that will be sent to the WhatsApp group or your emails or wherever you receive the links from. So the recordings will be sent out, or a notification for the recordings will be sent out, and also they would also be uploaded to the iAfrica Media YouTube page, so you can watch the lecture. So once again, sincere apologies. Our speaker for tonight is under the weather and will not be able to join in. So he will be recording the lecture and send it over once he's healthy enough to do so. Today we were supposed to discuss the impacts of lifestyle challenges on the ocular surface. We have touched a bit on this already from previous speakers. So he will give a recorded version of the lecture, and once he does, we would send that out, send an email to let everyone know. And also we would it will be uploaded to the iAfrica media page to enable everyone get access to it. However, tomorrow, our speaker for tomorrow, Dr. Georges, will be talking about the use of elective medications and elective procedures on the ocular surface. So we'll be talking about the use of hard drugs, cannabis, recreational drug use, and how those things affect the ocular surface or affect dry eye disease. We'll also be looking at elective procedures such as refractive surgery and how that affects the ocular surface. Also, some other information that's important to give. The TFOS Deuce 3 conference is coming up in October this year. So if there's anyone interested in participating, it's holding in Italy, in Venice, Italy this year. And if you're interested in participating or attending the workshop, you should visit the TFOS website. I'll just also take this opportunity now that we have the audience for it. I've got a couple of emails and questions about people asking how they can join TFOS or how they can become members of TFOS. Membership for TFOS is now free, so you can you're free to go to the website, register as a member, indicate your country, go through the bylaws of TFOS, go through the aims and objectives of TFOS, and membership is now free and available to everyone. There are certain benefits to being a member. You have access to the TFOS papers. You have access to a pool of cornea specialists around the world who are involved in ocular surface disease, clinical management, clinical research, randomized controlled trials. You get invited to workshops depending on your contribution to research and the topics of interest being studied at the time. It ranges from contact lens discomfort or contact lens induced dry eye to other forms of dry eye. You also get invited to different workshops that TFOS holds. They have been the TFOS Dues 1, TFOS Dues 2, now the TFOS Dues 3. There's been the lifestyle workshop, which we're looking at the reports now. There's also been the contact lens discomfort workshop, the meibomian gland dysfunction workshop, several workshops from TFOS over the years. So you get invited to those, again, depending on your contribution to research and your area of expertise, your area of research. You get invited to those. Also, TFOS does organize a couple of research programs here and there. So if that's something that you're interested in at any point, as a member, you will you could indicate that, and TFOS will give whatever resources available in terms of personnel with similar interests and in terms of whatever resources that you would need for such research. TFOS will be happy to support when they can or where they can, given the available sponsorship at the time. Another thing is when you join in TFOS, you can have access to the different workshops or the papers from different workshops or PowerPoints from different workshops. And if you want to present that at a local conference or a program or even a clinical presentation at your place of work, TFOS can provide you those kind of details. So there are several benefits to being a member of TFOS. Um, as we've said in the past days, the webinars are recorded and they would all be uploaded to the iAfrica Media website. So look out for those. Also look out for the TFOS dry practice survey. We've sent emails about this before. We'll be sending them again to remind you to fill them. This came about because over the years, when I've attended TFOS programs, whether it's the lifestyle program or the dual studies, or when papers about ocular surface disease or dry eye disease are being presented around the world, we're usually very few from Africa, if any. And this time, we want Africa to be represented, not just in terms of our participation, but also in terms of our data. So this survey helps us understand how you practice or how you carry out dry eye management, where you work, where you practice, and we're interested in understanding how you do this. So this survey would help us plan future research for Africa, plan future research for specific areas in Africa, and also educational programs, depending on the feedback or what we see from the survey. So please, when you get the links, please fill the survey. As I said earlier, the recordings are available on iAfrica Media. So do reach out, subscribe to the Africa Media channel. You'd get the notification whenever a recording is uploaded. Not just on the TFOS Lifestyle. There's so many other resources available there on ocular surface disease, dry eyes, contact lenses, and other areas of optometry, and also practice management, improving yourself as an optometrist. There are several things available on the TFOS, on the iAfrica Media website, rather. You can always email me. I'm happy to hear from anyone. Based on the feedback we've been getting from the workshops over the past couple of days, it seems there's a lot of interest in research. So that's one of the things that CEFI is interested in doing as well. So this webinar is being brought about by a partnership between TFOS and CEFI. So there will be obviously some recommendations from this lifestyle report, and we're looking at including research from Africa on a global stage, and that's where CEFI comes in. So if there are those of you who are interested in research participation from different parts of Africa, we're happy to hear from you, and we're happy for everyone to be part of the team. Once again, our speaker for this evening will not be able to make it due to certain health concerns. And he will, when he's healthy enough, he will be able to make a recording, which will be uploaded on iAfrica Media YouTube page. So if there's anyone who has questions, you can just leave them on the chat section based on what I've explained, and I will be happy to take those questions or comments. Thank you. Okay, so someone wants my email, and my email's there. You can just reach out to me, and I'll be happy to answer any questions you have. Once again, the recordings will be made available on iAfrica Media YouTube page. Also, when you get the emails for the links, for the survey rather, please fill the survey so that we have data for how dry eye is practiced in Africa. Also, I mentioned before, you can become a member of TFOS. Membership is now open and it's now free. You do not have to pay to become a member, and you have access to all the workshops that have been done before, whether it's the TFOS Dues 1, 2, the lifestyle workshop reports, the contact lenses comfort reports, the meibomian gland dysfunction workshop. You have access to that. You can also get resources if you are interested in doing a lecture in your country, in your community, at your place of work regarding ocular surface disease. As a member, you have access to those resources on the TFOS website. Also, depending on your area of research or clinical interest and your contribution to the field, TFOS may reach out to you when some of the workshops are being organized, and they will ensure that you have the adequate resources they can provide with sponsorship at the time to help you plan your event. You could just go to the TFOS website and you get more information on membership. Also, the TFOS use 3 conferences coming up in Venice, Italy this year. So if you're interested in attending, you can find more details on the TFOS website. Yes, you will get some people are asking about the slides. You will get access to the slides, yes, from the speakers. And the recordings for each lecture is available. Even the recording for today's lecture, which our presenter could not make, will be made available when he's healthy enough to do so. And that would also be uploaded on the TFOS website. I'll just go through and see if there's any other question I haven't answered. Yeah, and also for those interested in maybe research, at the end of the TFOS Lifestyle report, I think again, this is a partnership between TFOS and CEFI, so there will be some outcome in terms of research and future perspectives on how we can go forward in terms of how dry eyes and ocular surface disease is managed, or the prevalence across different parts of Africa and things like that. So sorry, just give me a minute.
Hello, Jesus Merayo speaking from Spain.
Oh yeah, our speaker was able to join in. Thank you so much. Hi, Jesus, can you hear me?
Yes, very good and clear.
Okay.
I sent you the video just in case the connection is not so good, and I
Oh,
am here for anything that you wish.
that's okay. So would you be able to share your slides? Can I
Yeah.
just give me a minute? I'll stop sharing mine. Again, thank you so much for making out the time given the situation.
Okay. Let me check where are the slides here.
All right, so I think you should be able to share your slides now.
Yeah, in 1 second. Slides are here. Slides are here. And did you see the slides?
Not yet. But how are you doing?
Good.
Okay, all right then.
And I
Okay, the
think
slides are coming up now.
that here.
Okay, so whenever you're ready, you just begin.
All right. So let me put a little more light here in order to make it better. For how long do you think that it takes is good for you?
About 30 minutes, but whatever's comfortable for you, that's fine.
Okay, perfect. So thank you very much for inviting me to present the lifestyle change in ocular surface and dry eye developed by TFOS. Before that, Well, these are my conflicts of interest. Before that, I want to introduce my institution briefly. I am the professor of ophthalmology of the University of Oviedo in the northwest of Spain. I devote all my research to ocular surface for many and many years ago. Oviedo is in the coast, in the border of the ocean, and our institute have clinical research and teaching activities with more than 250 people working there. We attend private patients and also students from the Public University of Oviedo. We perform like 8,000 surgeries per year with visits for more than 100,000 patients from all over Spain, Europe, and countries of Africa. Regarding teaching, we have postgraduate courses and programs, and masters, optometry, nursing, and then the specific of ophthalmology, and also the continuing education program. And our focus of research are nerves, because nerves matter in dry eye, in neuropathic keratopathy, or in the problems of neuropathic pain. Contact lenses, metabolic disorders, infectious diseases, surgery can perform hypoesthesia, hyperesthesia, or pain. That is studied since in Spain since more than 130 years by our Nobel Prize Santiago Ramón y Cajal. And we also focus in biomarkers of the damage of the nerves, the anatomy, and how the cells, the nerves talk with the immune system. Regarding function, also we work in the function and in the receptors of the nerves of the ocular surface. And regarding clinic, we measure the problems of the ocular surface with psychometric tests, with questionnaires, some like the visual analogical scale questionnaires, the Valpanda Reda scale also, that we are doing that now, the validation, the clinical validation. Confocal microscopy is very useful to study nerves. We describe in the world the first paper of the optic of the nerves of the cornea neuropathy regarding the COVID-19. We can see inflammatory cells, we can see neurons, and also infectious disorders like acanthamoeba, fungal keratitis, or the problem regarding herpes virus. Also, in the last year, we were working in a new device that measures corneal sensitivity that for years have been done with the Cochet-Bonnet manual or with researchers devices. And this device is very easy to use. It's attached to the slit lamp. Here in the video, the chief of the optometric department of the Fernández Vega Institute is performing that to another optometrist, and it's in real time. So as you see, it's very quick, and we have information regarding the sensation of the eye without any intervention, without touching the eye. Regarding treatment, we are very interested in neuropathic pain, and we care for this patient, protecting the ocular surface, modulating the threshold, and doing the medication for the first, the second, or the third neuron. Also regarding nerves and tissue in the ocular surface, we are working on regeneration of the ocular surface for the unmet clinical needs of neurotrophic keratopathy, problems of trophies of the ocular surface, fibrosis, scars in the ocular surface with, for example, patients with atopic keratoconjunctivitis or ocular cicatricial pemphigoid, Steven-Johnson spectrum, chemical burns. And during the last 15 years, there are several PhD theses defended more than 40 papers that shows the evidences of this regeneration with the platelets, because are the platelets the protagonists of this regeneration of the ocular surface with this plasma-rich growth factor in the pharmacological way of collyrium, fibrin clot of membranes for surgery that you can stitch, you can make the suturation. In summary, we can regenerate the ocular surface, reversing the fibrosis, promote the regeneration with different eye drops or clots or membranes, and it belongs to the blood of the patient, so can be performed in any place. And regarding the topic of today, the lifestyle change, well, there are a lot of lifestyle change that affect the ocular surface, and we divide it in several blocks. The group of doctors working on this section are shown in the picture, chaired by Anat Galor from the Bascom Palmer Institute in Miami. We review epidemiological studies like meta-analysis, systemic reviews, population-based study, hospital-based, and case control and case series studies. And we make the aggregation in three parts. The first one are mental factors that are, for example, depression, anxiety, resiliency, stress, or sleep. And if I have to choose one for the eye care practice, I will select sleep, because sleep is a procedure that everybody do and is susceptible to change, susceptible to make it wrong. We can measure the sleep. The way that we measure is with the Edward scale, and it gives you information, for example, of sleep apnea, that there are not enough foods through the blood in the ocular surface and in other part of the brain, or patients that have problems with the sleep do not move the eyes in the face of the rapid eye movement, causing problems on the ocular surface. There are several ways to measure that with experimental models, also with meta-analysis, and well, there are other potential underlying contributors for these sleep disorders. Psychiatric pathology like depression, there are papers that make the relationship with the ocular surface disorders, and also some that are not. But the depression, the change of the mood, and the care for these patients with antidepressant treatment make problems in the ocular surface with different approaches. The other disorder, like anxiety, also is related to that with several evidence, and is well recognized also. Stress is also related to ocular surface problems. We recommend patients to do the exercise in the morning in order to increase the threshold of inflammation, the threshold for stress. And regarding the part two, the physical factors, there are several, like physical activity, inactivity, obesity, interventions like the use of mask during this COVID period, or the use of CPAP, the continuous positive airway pressure. But if I have to choose one, I will select eye rubbing, because it's very common in patients with pathology, very common in allergy, very common in patients with keratoconus. And the eye rubbing is associated in some papers with keratoconus. So the message is to teach the patients, to educate the patients in not rub the eye, and if they feel itching or other problem, put cold, ice is nice in the eye, in order to do not make the necessity of rubbing. Obesity and symptoms are related also with death, with multiple mechanisms, and the use of CPAP and the use of mask are related, for example, with meibomian gland dysfunction and other problems related with the inflammation of the meibomian glands. Sexual issues are also important because the problem of the ocular surface could eventually affect other mucosas, and also is related, and we care for these patients for all the mucosas of the body. And also its relation with pain. The patients that have permanent pain disorders, fibromyalgia, and other problems related with pain are susceptible to have more and more problems in the ocular surface by different evidence that you can check in the paper. For example, in fibromyalgia, there are these evidence. In intestinal bowel disease, also there is a high evidence. Remember that all the mucosa are connected. In order to care for the patients with dry eye, we need not to have stress, not to have the inflamed brain, and not to inflame the bowel, or, in order to have this smooth and not inflamed mucosa in all the body. Back pain is also related, and there are some potential bias, but I think that we need to have in mind that pain is related with problems in the ocular surface. Regarding social factors, that is the last part, there are most of the social factors are related with ocular surface disorders, except caffeine, that is protective. So the habit of to drink caffeine protects the ocular surface. The evidence for that, well, differs from papers to papers, but tobacco smoking, things around tobacco smoking are related with pathology of the ocular surface and dry eye. Cannabis consumption is related with corneal endothelial density. Alcohol and the habits and the lifestyle associated with alcohol consumption is related also with problems of the ocular surface. For example, there are patients that have associated vitamin A deficiency. And as I talked before, caffeine shows protective effect in the care of patients with dry eye disorders. The main message of this lifestyle thing is that mental health problems are related to death, especially anxiety, depression, and the treatment for these disorders. Regarding physical factors, obesity is a problem in Spain and in Europe, but also rubbing of the eyes is a risk factor that we have to have in mind. And also there are new lifestyle change like the mask wearing that can make problems with the meibomian gland dysfunctions. And regarding physical factors, if I have to choose one, I will select pain, because we, in the schools of medicine, in the healthcare systems, sometimes we are not teach appropriate to deal with pain, and this is important, especially in the most innervated part of the body, that is the ocular surface and the cornea, that can promote this neuropathic pain, that when we do not stop the problem in the ocular surface, we have very bad conditions to care for that, with the second neuron activation and the central pain problem. Regarding social factors, all of them are related with dry eye, all of the factors studied, except the caffeine. So thank you very much for your attention. You have a lot of information in the papers that are open for reading for everybody. And here is my email. and the webpage information. And if you want to contact us or to visit us, we are more than happy to show the research and the facilities. Thank you very much.
Oh, thank you so much, Dr. Jesus. And thank you for making out the time to do this despite everything. Um, I don't know if I mean, I guess some questions will come in later, but I have a couple of questions, maybe one or two. Um, so I'll just give one of the questions, and if you could give an answer. So my first question relates to sleep and dry eye disease. Um, is there a way you could explain the relationship? How does sleep relate to or sleep pattern relate to dry eye disease?
Yeah, in the literature review, there are like in every part of the study, several evidence against in con. But in the clinic, in the day-to-day, in the real world patients, I have patients that have a floppy eye syndrome, and not the typical one of the big picnic syndrome. Just if you touch the superior lid, and if it's with a problem of that is very soft, you can move it, and this is related with the glottis also smooth. So the patient have problems, most of them have problems of apnea that are not detected. If the patient have sleep apnea, not only the ocular surface is affected, it's affected also the back of the eye with risk of vein
Glaucoma?
thrombo or the risk of low tension glaucoma. But in the ocular surface, the main problem is the hypoxia, and especially related with patients that wear contact lenses that develop more risky the vessels, the limbal insufficiency, and the conjunctivalization of the cornea. So sleep and disorder and sleep apnea is my first one, and the second one is that this patient do not rest appropriately. The eyes do not move appropriately in the REM phase, and this patient do not have this period of regenerate the ocular surface. Also, if this patient sleep less hours, they have the eyes more open than expected, and the risk for having problems of the ocular surface like dry eye and others is very high.
Yeah. So thank you for that. I mean, I think the relationship is quite a complex one because if you're dealing with sleep disorders, these patients have to use the CPAP devices, and the CPAP devices themselves can cause some ocular surface disease symptoms. And with the floppy eyelid, as you said, these patients who have sleep apneas may have floppy eyelids, and then there's also a link with keratoconus. So I think it's really a complex relationship. So thank you
Well,
so much for that.
the message to my patients that when they use the CPAP is that
Mhm.
it's mandatory for them because I need them alive without any stroke, without
Yeah.
anything. And
Hmm.
if the mask is not very good attached to the nose,
Yeah.
just put anything that can attach well, because the dryness associated to the use of the CPAP, it's a question of teach them to use the CPAP. But for the healthy of the anterior part of the eye and the posterior part, is mandatory for them to lower the risk of the sleep apnea with losing weight and using the device.
Yeah, I mean, when you mentioned that, I currently have a patient who has keratoconus, sleep apnea, floppy eyelid syndrome, and obesity. And he struggles with the CPAP device actually because
Yeah.
it's difficult. When he puts it on, he finds it uncomfortable. He feels it's choking. I think I'll take your advice. We need the patient alive.
Yeah.
Yeah.
Well, I strongly recommend this patient that if they have to change, for example, her husband or his wife, or change that for the CPAP, choose first the CPAP, and they understand very well the job.
Well, that's good advice. We have some questions from the audience. So someone wants you to explain about the link between sexual issues, as you mentioned, and ocular surface disease. So there was a part where you mentioned things about erectile dysfunction, the medications for erectile dysfunction, and how that can impact the ocular surface. So can you throw more light on that? There was a
Yeah.
slide on it.
As you know, the mucosa of the ocular surface is not different from the other mucosa. So, if there is inflammation in the ocular surface, and there are any systemic disorder that maybe is not very manifest in other mucosa, to care for the ocular surface will care for the rest of the body. For example, in patients with Sjogren's syndrome, sometimes when you have a quiet bowel, bowel without inflammation, imagine in our media in Europe, if you remove, for example, lactose, and if you remove the celiac, the gluten components, they will have the gut mucosa very well. They notice immediately, and the eye will become less inflamed, and also the vaginal mucosa. So that is related, for example, with these disorders that are more common in females than in males.
Okay, thank you so much for that. So the next question looks or talks rather about just give me a minute. What would be the relationship between migraines and dry eye disease?
Yeah, patient with migraines again. There are most of them that in my practice, most of them are females also. They have an inflammatory status. And this inflammatory status, in most of the cases, is related with autoimmune disorders that eventually are not affected to other part of the body. Sometimes the ocular surface is the target tissue for the autoimmune disorders, and this alteration of the vessels, this vascular alteration, are manifested with symptoms of migraine, headache, or vasculitis, or other problems. So when we have, and sometimes also when the ocular surface is the trigger, can trigger the migraine. So to use a hat, to use sunglasses, and to have the ocular surface quiet will improve the symptoms of migraine in order to avoid the symptoms. And for this patient, I have the same recommendation than I tell before. Quiet gut and quiet Ryan to treat also this patient beside the medication of the migraine.
All right, thank you so much. And to take it a step further, you mentioned about migraines. There are also some other things that are still sort of controversial in terms of how they affect dry eye disease. For example, how does caffeine affect dry eye? Does it make it better? Does it make it worse? Based on the lifestyle report, the lifestyle challenges report, what was the take from that?
Yeah, my impression is that for hundreds of years, in some parts of the world, the people drinks tea or drinks caffeine, and these autocoats preserve the ocular surface from allergies, preserve the ocular surface from inflammation. And for example, if we talk about South America, it's very common the consuming of coffee. Well, with this habit, I think that with the epidemiological data, we can make the connection that this could eventually decrease the inflammation in the ocular surface. Imagine all the comorbidities of the ocular surface, dry eye, and allergies that are treated in several African countries and Asian countries with teas, with different teas.
All right. And aside caffeine, you also mentioned cannabis. And can you tell us how that may affect dry eyes or maybe worsen the tear breakup time?
Well, it's not only the cannabis consumption, it's also the things around that. So you have toxic effect of the smoke in the ocular surface, destroy the mucus layer, provokes or enhance the dry eye. But one of the things that we saw in the literature review is that also the number of cells in the endothelial layer are decreased. Well, we are talking about neuroepithelial. So my impression is that the same effect could affect the trabecular meshwork or other neuroepithelials that are also important to keep the brain happy.
Okay, so thank you so much for that. So the next question, I'll just scroll here. I think we've talked about alcohol and we've talked about cannabis. I think there was one other question here. Yes, I think you touched on how you talked about autoimmune diseases and how that can affect the ocular surface as well. So someone has a question asking, can you throw more light on irritable bowel movement or irritable bowel syndrome or disease and how that may affect the ocular surface?
Yeah. As you know, this intestinal bowel disease, both ulcerative colitis, the related diseases, um, irritate the epithelial, irritate the epithelial of the gut, but not only the gut, can affect any part of the mucosa, from the eye to the anus. So the care for these patients should be for all the mucosa. Sometimes the trigger for a vasculitis in the patient with Crohn's disorder is the eye, and you can see the vasculitis as an ulcer, as a conjunctival ulcer, or the same ulcer can appear in the gut. So all the mucosa should be treated in the holistic fashion.
All right, thank you so much, Dr. Jesus. We really appreciate your time today. This has been really interesting, and thank you so much for making out the time despite um, everything to go through the lifestyle report and answer the questions patiently. We really appreciate your time and we wish you all the best and good health as well. Thank you so much.
Thank you very much. I hope to visit Nigeria anytime. Be free to come to visit us as you wish. Thank you. Thank you very much.
Thank you so much. Have a nice day, everyone.
Bye.
Yeah, bye. All right, so for everyone, the recordings will be made available on the iAfrica Media YouTube page. Look out for the surveys, fill the surveys. Also remember, Cephi is part of this, and at the end of the lifestyle report, there will definitely be some follow up from this end. Aside from looking at certifications, we're also looking at future participations and collaborations in terms of ocular surface disease research across Africa, so we can get Africa, the data for Africa out there. Thank you all once again for joining in. And tomorrow we'll be looking at the impact of elective medications and procedures. That promises to be really exciting because we'll be talking about recreational drug use and the ocular surface, and also looking at surgical procedures such as refractive surgery and how that can impact the ocular surface as well. Thank you all for joining in. If you have if you need to reach me or you have further questions or contributions, I'll just share my email once more so that that's available. So yeah. So you can always reach me. My email is available there. And I'll be happy to hear from you. If you want to reach out to Dr. Jesus, his email's up there as well. Feel free to reach out to him as well. Thank you all for joining and enjoy the rest of your evening. We'll see you tomorrow.